What I have learned in HS 410, Issues in Aging. I have learned about Alzheimer's in other classes, but in Issues in Aging, I learned about a different aspect of it, how different environments affect an individual with Alzheimer's. It is important to make an elderly person's room look as much like home as possible to create less confusion, putting the individual at ease. Color and contrast are also important in order to help the elderly with Alzheimer's navigate throughout a room. It was interesting to learn that patients with Alzheimer's disease thought the tan circles on a rug were piles of sand, so they did not want to step there. My group's presentation was on long-term care facilities. I personally presented on the Adult Daycare Center in Stevens Point. Before doing some research, I did not know adult daycare centers existed. It was very interesting to research and talk to the director at the facility to learn about the different services offered. It literally is like a daycare center you would take your children to. An adult daycare center is a planned program of activities designed to promote well-being through social and health-related services. They enable seniors to socialize with others while still receiving needed care services. They also offer caregivers a break from caregiving duties while knowing that their loved one is in good hands. Some services offered include assistance with personal care, nutritious meals and snacks, health monitoring and medication supervision, therapeutic music, games, and crafts, regular exercise and range of motion activities, entertainment and recreational opportunities, showering assistance, foot care, glucose monitoring, beautician services, and a drop-in service. A drop-in service allows a caregiver to drop off an elderly person with a 24-hour notice even though they are not an established member and do not have a plan with the adult daycare center. From Dr. Summers' presentation, we learned about medication and the elderly. An elderly individual takes on average of 6 to 8 medications every day. These medications can have adverse effects on the body. One is an enhanced drug effect. This can be due to an allergy or increased sensitivity leading to the drug having more of an effect or due to the person's metabolism. There is increased concentration of the drug because of a decline in renal function, decline in liver metabolism, and decreased lean body mass and body water content with an increase in total body fat. An increase in drug sensitivity is caused by a decrease in homeostatic responses such as baroreceptors responses, glucose control, and electrolyte control. Also, with individuals taking so many drugs, there is an increased risk for drug-to-drug interaction. There is a 10% adverse reaction rate. Physical activity is also very important in the elderly. The biggest hazard of immobility is death. Activity levels in the elderly is especially low. It is important not to overwork an elderly person to the point where they hurt because then they may not come back the next day. It is important to encourage them to exercise to receive health benefits such as chronic disease prevention, especially heart disease, maintaining bone mass, and improving well-being and sleep function. Health promotion is also important to the elderly. The elderly tend to want to do as little physical activity and exercise as possible, but we all know that physical activity and exercise are very important to an elderly individual. Another important aspect is preventative care. Important screenings for the elderly include prostate cancer, heart disease, hypertension, high cholesterol, osteoporosis, vision, hearing, and problem drinking. I can apply these concepts in my future career as a physical therapist in reminding the elderly to keep moving. The use it or lose it phenomenon is true. And although I am not a doctor, and because of the high numbers of pills elderly individuals take, I can remind them of the drug-to-drug interactions when they ask me what medication to take to relieve pain they are having. Overall, I have learned a lot and thought the course to be interesting.